Respiratory syncytial virus can have devastating outcomes.
This can be just as deadly as influenza.
Dr. Samir Sinha is thrilled shots for seniors will go into arms this fall. However, he warns a patchwork of publicly funded coverage will undermine the vaccine's effectiveness.
Health Canada says we approve for this vaccine to be used anywhere in Canada for this population 60 and older. It then comes up to the provinces to make a determination as to whether they're going to cover this or not, and how they will allow it to be administered.
Ontario has chosen to publicly fund the vaccine for people 60 and older living in most congregate care settings. Other provinces say they are awaiting federal guidelines before determining whether they will follow suit. In BC, the cost for an RSV vaccine is roughly $230. Experts say some private insurance plans will cover the cost of getting a RSV vaccine. Further guidance from NACI isn't expected until next fall.
If you don't have coverage by the provincial health plan that you're in, then it's going to be up to you to see if you can afford to keep yourself healthy. And that is absolutely not what we want for vaccines.
Advocates say it's important older Canadians are not forgotten.
We know that Canadians will be more reluctant to get a vaccine that they have to pay for out of pocket, because sometimes they might think, well, if it's important, the government will cover it. But I guess it's not important enough for it to be covered.
You would think with COVID-19 that we would take vaccines really seriously and that governments would want to fund all NACI recommended vaccines, but it hasn't been the case.
Catherine Ward, Global News, Toronto.